Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we will explore multiple choice questions related to the extraction of maxillary molars. After the MCQ explanation, we will discuss the key concepts underlying these questions. This discussion will enhance your exam preparation effectively. A 50-year-old patient has a maxillary molar with widely divergent buccal and palatal roots. The surgeon decides to divide the tooth for easier extraction. Which step should be performed first in this extraction procedure? This is done after reflecting the flap and removing some crystal bone. This happens after the crown and buccal roots are managed. This is the correct option. This is the initial step to expose the area for further procedure. The standard envelope flap is reflected to expose the area for sectioning and removing the roots. This is done later in the procedure. This is done after the buccal roots are sectioned. So the correct answer is option C. During the extraction of a maxillary molar, the surgeon needs to avoid fracturing the palatal root. What type of force should be avoided to prevent palatal root fracture? Should be carefully controlled, especially near the maxillary sinus. This is the recommended direction to avoid palatal root fracture. C and D are not typically used in this context. Can cause the palatal root to fracture. Applying palatal force can result in the fracture of palatal root. So the correct answer is E. It is the palatal force that should be avoided to prevent palatal root fracture. A patient's maxillary molar crown is intact and the surgeon needs to remove it along with palatal root. How should the crown and palatal root be delivered? Careful control is needed to avoid sinus damage. This is the correct direction for delivering the crown and palatal root. Upper molar forceps are used to remove the crown portion of the tooth along with the palatal root. The tooth is delivered in the bucco-occlusal direction, and no palatal pressure is used because it would probably cause a fracture of the palatal root from the crown portion. C and D not typically applied for maxillary molars. Can cause fracture of the palatal root. So the correct answer is B. The entire delivery force should be in the buccal direction to avoid fracturing the palatal root. When extracting a maxillary molar with a missing crown or fractured crown, how much buccal bone should be removed to expose the tooth for sectioning? May not provide sufficient exposure, sufficient to expose the tooth for sectioning. A moderate amount of buccal bone is removed to expose the tooth for sectioning. As you can see, more than necessary could be excessive, would not allow proper access, unnecessary and excessive. So the correct answer is B. After removing the two roots of a maxillary molar with intact crown, the palatal root remains. The surgeon needs to use an elevator efficiently. In which direction should the elevator be directed to displace the palatal root? Applied pressure must be carefully controlled. Correct direction for displacing the palatal root. The small straight elevator should be directed down the periodontal ligament space on the palatal aspect to displace the root in the bucco-occlusal direction. C and D not typically used for this purpose. Incorrect direction for this context. So the correct option is B. Let's go over the main ideas that these multiple choice questions are based on. Maxillary molars are more complex to extract due to their three-rooted structure, necessitating a strategic approach to avoid excessive force. Reflecting the flap and sectioning the roots allow for the controlled removal of the crown and palatal root, minimizing the risk of fractures. When an intact maxillary molar must be divided for careful removal, as when extreme divergence of roots is found, a small envelope incision is made, and this flap is reflected, and a small amount of crystal bone is removed. This allows the burr to be used to section the buccal root from the crown portion of the tooth. The upper molar forceps are then used to remove the crown portion of the tooth along with the palatal root. The tooth is delivered in the bucco-occlusal direction, and no palatal pressure is used because it would probably cause a fracture of the palatal root from the crown portion. Applying force in the buccal direction prevents palatal root fractures, as explained earlier. The controlled luxation allows for safe removal of the roots. The straight elevator is then used to mobilize the buccal roots and can occasionally be used to deliver these roots. The crier elevator can be used in the usual fashion by placing the tip of the elevator into the empty socket and rotating it to deliver the remaining root. And a purchase point will be made with the help of a bar. Careful control of apical forces prevent damage to the maxillary sinus during the use of straight elevator. The procedure for a missing or a fractured crown involves additional bone removal and careful sectioning to facilitate root extraction. If the crown of the upper molar has been lost to caries or has been fractured from the roots, a small envelope incision is reflected and a small amount of crystal bone is removed. The burr is then used to section the three roots into independent portions, that is the two buccal and one palatal, as explained earlier. After the roots have been luxated with the small elevator, the mesiobuccal root is delivered with the crier elevator placed in the slot prepared by the burr, that is the purchase point. Once the mesiobuccal root has been removed, the crier elevator is again used to deliver the distal root. The tip of the crier elevator is placed into the empty socket of the mesiobuccal root and turned in the usual fashion to deliver the tooth root. Independent access to the roots can simplify the extraction process, and the palatal root is removed last to prevent complications. Two methods to remove a palatal root, one with forceps, other with the small straight elevator. Here you can see maxillary root forceps occasionally can be used to grasp and deliver the remaining palatal root. Loss of the interradicular bone allows for efficient use of elevators, and careful manipulation ensures the safe removal of the palatal root. The small straight elevator can be used to elevate and displace the remaining root, that is the palatal of the maxillary molar, in the bucco-occlusal direction with gentle to and fro motion as shown in this figure. Thank you. Wish you best of luck.